Hello, everyone. Welcome to another episode of Navigating Cancer Together. It is the show that has something for everyone facing cancer. Why? Because everyone is different with different needs, beliefs, and perspectives. Thank you for joining us for this episode. I encourage you to open your minds and your hearts. Navigating Cancer Together is everywhere. Make sure to subscribe and follow the show to stay updated on our latest episodes. Listen on Spotify, Apple Podcasts, YouTube, or your preferred podcast app or platform. I am so excited to bring a very special guest today on to Navigating Cancer Together. In honor of Men's Health Month, I am so excited to welcome Mr. Clarence Jones to the show. Clarence is a leader who wears many hats, but today he joins us with a personal perspective as a prostate cancer survivor. His journey informs the incredible work he does as the executive director of the Hue-MAN Partnership, where he champions the belief that healthy men are the foundation of healthy families and thriving communities. From teaching medicine at Mayo Clinic as an adjunct instructor to serving the community as a fatherhood doula. We're going to learn more about that. Clarence is a true community strategist for health equity. You may also recognize his voice on KMOJ's Community Health Dialogue or on his podcast, Health Chatter. He's a founding force for wellness in Minnesota and a powerful voice for every man navigating a diagnosis. Clarence, thank you so much for joining us and welcome to the show.
Thank you for that wonderful introduction. That was really phenomenal.
Thank you, Clarence. That means a lot coming from you. So excited to have you here today. Clarence, before we dive into your professional work and all the wonderful things that you're doing, I'd love for our listeners to get to know the man behind the titles and decades of honorable work. What is something unique about you that might surprise people? And what is one thing that brings you genuine happiness these days?
I think one of the things that brings me genuine happiness really is the opportunity to work collaboratively in my community. I really believe that it's so important for us as a community to work together and to value each other and to make sure that those that are designed to be the leaders lead. And I think that that's one of the things that I'm excited about you today, is that after conversations with you and talking with other people about you, you're one of those people that we call a treasure in our community. And so I'm really excited about being able to promote you and tell others about you and also to make our community healthier. So that's part of what you asked me for. But I think the other part too, I want to just share this with you, is that I love working in community. I've always enjoyed the opportunity to share information with people. And it's taken a while to really learn how to do that effectively. But I'm at that point right now where I think I'm older now. And so, being older, you kind of like a little bit more risk-free. But I still enjoy the opportunity to talk to people about becoming healthier, and especially when it comes to men and fathers.
Thank you so much, Clarence. You are doing amazing work. And later in the conversation, the listeners will get to hear more about it. What's something unique about you?
It's quite interesting. I think I've been very blessed as a person to have developed relationships with a lot of different individuals. But I think one of the things that's really unique about me is that I really value honesty and transparency. I really value that. And I really do want to find allies in our community because I love the work that I do. Okay. It's really not work. This is more of a joy. But for me, I want to be able to really find people that are really doing the work and come alongside of them as we work together for the community.
Thank you, Clarence. You are doing that for sure. I appreciate that. It's very important. We're heading into Men's Health Month in June. You have a personal connection to this cause. Could you walk us through the moment you learned you had prostate cancer? What were those early days like for you?
So the interesting thing for me was that prostate cancer was always a lingering mystery for me. And what I mean by that is that I knew about it and I knew that a lot of people had it. So I was always interested in it. And so the idea of prostate cancer, especially for Black men, because what I really found out was that if you want to get a Black man to go to the doctor, tell him he got prostate cancer or inform him that there's a possibility that he may have prostate cancer. And I think what's interesting about that really is the fact that prostate cancer is so prevalent in our community that people are aware of its impact. I think the other part about it too is that men, especially getting a digital exam is really something like, man, I don't want to do that. And so it's really one of those things that I truly believe that it's a driver. And so I wanted to be at the lead of that because I realized that the possibility that I might have it or my friends might have it as a community health advisor, I wanted to make sure that I knew as much about it as I possibly could.
Clarence, how did you learn you had prostate cancer? What was that like? What was the process like? Did you just happen to go to the doctor
Mhm.
because you had a concern, or were you having some symptoms?
Actually, no, I do an annual exam. I go to
Okay.
the doctor and they went from 4 to 6. The next thing I know was 10 and then 12 and 13. And like, okay, we have to take a look at this. And because I had some awareness of it and its impact, and I just like, let me do that watchful waiting. So I did a
Mm-hmm.
lot of watchful waiting with that as I talked with my doctor about the issues. And so when it got to a point where I was like 23, 24, like, time to take care of this. I did a biopsy. I did all those kinds of things, but I was hoping that I wouldn't have to get an operation. But unfortunately, I did. But fortunately, I did. You know what I'm saying? So I'm happy that I did take care of it.
Good. I'm happy you did as well. And you were proactive, it sounds like. You stayed on top of your
Mhm,
exams, your appointments, and things like that. It wasn't something that just kind
mhm,
of hit you one day, which happens a lot.
mhm,
Men in particular tend
mhm,
to wait until things are very dire and it's very
mhm,
late in the game, and they go through a lot of things that maybe they
mhm.
could have prevented.
I would agree with that. And I think that's part of I do my work is that I realize something that we experience in our community is avoidable or manageable if we would take the opportunity to take a look at the things that we are experiencing or that we know that are part of our family history. If we would just take the time to look at that, I think that makes it so much better.
Yes, I agree. Clarence, looking back at that specific season of your life, what did that experience teach that
Mhm.
you didn't know before?
I think I don't know that it taught me anything differently because I was watching it. Now I was talking about it. I went to school to learn about it. I think what it did for me, though, it just taught me that I had to be more diligent in talking to my community about it. It's one thing to go through it. I mean, to go through the operation and things of that nature.
Mm.
But when it happens to you, it makes you realize how important it is if you get through this to make sure that other people are aware of it and that you align yourself with people that can help to magnify that information. One of the things that was really exciting for me is that when I found out that you were a cancer doula, like,
Mm.
what? A cancer doula? What's that?
Mhm.
But it was a way for me to find someone who could help to magnify the information. And so here we are. We're magnifying this information and we're trying to make people aware of it and find ways in which to address those issues and make our families stronger, which is also very, very important.
Absolutely. Clarence, for men listening who might be hesitant about the screenings, how do we invite men into the conversations about their health instead of just telling them, hey, you should do this, you should do that? How do we
Mhm,
talk about the why
mhm.
behind early detection without feeling like we're lecturing them or talking down to them?
I think for the most part, for me, it's not about lecturing because I think a lot of men know about prostate cancer. I think the idea, though, for a lot of them is for you to be encouraging for them to look at it. I remember my wife talked to me. I always talk about this, and I'm always careful about how I say this, but she nagged me for about 5 years before I went to the doctor.
Mm-hmm.
And I think a lot of times that's what your partners do. They just, well, you should go see this. And yeah, okay, right. I was 5 years before I got to the doctor, and the doctor was right around the corner.
Oh,
So,
yes.
like that, it's one of those kinds of things. It's one of those kind of things where you have to have someone who really is concerned about you. And then once you go to the doctor, they have to ask you the question. So what did he say? What did she say?
Mm.
And then once you kind of confess, then it's like they're going to begin to encourage you and to watch with you and to ask, did you, and make sure that you do your annual exam. And that's really what you want. And it doesn't have to be a wife or a partner. It's just somebody that really cares about you and that's willing to ask you those questions about you and about your health. So I think that's one of the things that was so interesting for me.
You bring up a great point, Clarence, and anybody can be an advocate. It could be a friend, it could be a
Hmm.
spouse, a coworker, it could be someone in your community. So
Hmm.
I love how you said it could be anyone that cares about you and your health and your
Hmm.
well-being.
Yeah, one of the things that I always talk about is there is a thing called business and business. And I think
Yes.
people are really concerned when people are getting into their business. Okay. That's just being nosy. But I think the business of caring about someone is so important. I think we talked a little bit earlier after I got a chance to know you. My
Mhm.
business is to find ways to promote you because of the work that you do. My business is to make sure that the community also understands the value that you bring as a cancer doula. You know what I mean? And so
Mhm.
when I'm out talking about a variety of different things, I want to make sure that we talk about the issue, but we also talk about the resources and the support. So that for me is so very, very important.
Thank you, Clarence. We both know that navigating the healthcare system requires one to really use their voice or, again, have their own advocate. Is there a story that you can share from your journey where you had to advocate for yourself? And also, how did that moment change the course of your care, if at all?
I'm always advocating for myself. I don't think that the advocacy for myself always has to be a trial. Okay.
Mhm.
I think advocating for myself means that when I go to the doctor, that I have some questions for them. That when the doctor says a certain thing, I should ask them a question like, what does that mean? One of the problems or concerns that I have so many times is that when we start talking about our issues, sometimes there's a language barrier that's there. And so for me to be able to advocate for myself, I have to also take the time to understand. For example, we always use the term, if you're more seasoned, you might say, well, I got the sugars, or my mother had the sugars. Well, the doctor will say, well, you got diabetes or something. So it's like being prepared to have a conversation. And when you don't understand something, ask the question. And
Mhm.
so that's what I think in terms of advocating for yourself, that's what it means. Is just that you go there prepared. And I think sometimes people don't want to ask questions because they want to walk out of there feeling like, oh, well, he didn't mention it. Well, hello. I mean, if you're struggling and you didn't talk about it, then you're not really doing yourself much good. And what happens a lot of times with men, especially, is that because they don't want to talk about it, by the time they find out about it or where they're forced to come to face it, they're like in stage 4, stage 5. And so
Mhm.
they lose the opportunity to have a longer life. They lose the opportunity to see their children grow or establish a more stronger relationship. And I just don't think that with the technology and the information that we have today, that we have to do that. And again, I know that the struggle to lay really about having myths and things like that. I talk to people sometimes. Remember the Tuskegee
Mm.
incident? So what was it? They don't know. They just oh well, it's Tuskegee and somebody did something wrong to us. Like, you need to know. I mean, if you're going to resist or not you doing it, especially when something is so easily available in terms of learning what it's about. So for me, part of the journey that I have really is about helping to address the myths and the misconceptions, helping to find people, like I said before, who are treasures in our community, ensure that they get to talk about these things.
Clarence, thank you so much for pointing out those very important points that people sometimes miss. If you would be so kind to share with the audience, the younger men out there listening who may not be familiar
Mhm.
with the PSA screening, what is that
Mhm.
process like? Can you give them some insight on what they could
Mhm.
potentially expect?
I think one of the things that a lot of young men have heard about was the digital exam, where the doctor uses his finger to find whether or not your prostate cancer is growing or if there's a distortion on it. Okay. That's one of the things, if it's enlarged, I use that word. Okay. The other one is where they actually take some blood and they measure the PSA in the bloodstream. And so I think they watch that. For example, if you're at like 6, 7, 8, or something of that nature, then there's quite a possibility of prostate cancer. And then they do a biopsy at times, but they actually take a medical instrument and they take pieces from your prostate to find out what its impact is or how much it's grown or if it's grown. I think the first time I took the biopsy, which is uncomfortable. So let's talk about it. It's very uncomfortable, but at the same time, I wanted to live.
Mhm.
The thing for me was that they took the biopsy, and I think in 3 different sections, there was some cancer that was saying. So once again, I chose to do the watchful waiting
Mhm.
because I wanted to avoid the operation if it was possible. So that's what you can expect. You can expect you're going to be uncomfortable, but the objective is to be healthy. If you got cancer, the options are reduced if you don't take care of it. If you just keep avoiding it, the other part too, like I said, is that because for a lot of guys, the operation or the testing comes to your anus, a lot of guys like, nah, I can't do that, I can't do that. But you know, you want to get healthy. You have to not think of yourself in a way that would stop you from taking care of your health.
Thank you for your honesty and transparency. I think that is an important
Mhm.
part that is not often shared. People don't really tell the truth about how things really are, or how
Mhm.
screenings really are, or how they feel. And so that can create a lot of uncertainty as well. Thank you for being so candid about
Mhm.
that.
Well, let me share something else with you, which I think is important for people to know. It is uncomfortable to get a digital exam, but they're not up in there for like 2 or 3 minutes. They
Mhm.
go up in there is a very quick 10 seconds maybe, and then come out. They're not digging for gold.
Okay.
It's like they're just trying to figure out whether or not it's enlarged or not.
Now let's transition to Hue-MAN. And I'm so excited for the valued listeners out there to learn more about your organization. Tell us about the work
Mhm.
that you're doing at the Hue-MAN Partnership.
It's been around for over 20 years in different iterations and things of that nature, but we've always been a coalition of collaborators who work on public health issues that the community identifies as important. So we've always been at that space and place where we listen to the community. We go to focus groups. We are involved in a lot of different activities very quietly because what we're trying to do is not trying to be out front as much as we are trying to be able to provide information that's appropriate, accurate, evidence based, but also believable.
Mm.
Because we understand the challenges that we have in our community around people believing or wanting to be engaged because of a variety of different things. So, our goal has always been to be credible so that we can talk about the hard issues. You know what I mean? It's not that we want to talk about hard issues, but we know that there has to be a certain amount of credibility that you have if you want to talk to people. For example, talking about prostate cancer, people that would work with us, and if we were out there talking about prostate cancer, they would know that we're not playing games with them. I mean,
Yes.
just for example, I'm laughing and I'm saying some funny kind of things, but the reality is that I care and the people that we work with care. And so it just makes a difference. It just makes a difference in terms of presenting information to folks is that we have to be credible, we have to be believable, and we have to be authentic. When I don't know something, I said this a little earlier to you. I said, if I don't know something, I'll tell you, I don't know.
Mhm.
That doesn't mean that I don't care. It's just that there's just so many things that are going on in communities. Some things I just don't know. And so okay with that.
Yeah. And I think that adds to your credibility is the fact that you're willing to say, I don't know. A lot of times people will pretend like they do, like they're just the expert on everything. But just being honest and saying, I don't know. That's perfectly fine.
But that's why Hue-Man, I think, is so successful, if I want to say it like that, because we are collaborators and we have always collaborated with our community. We have over 300,000 health screenings that we have
Mhm.
performed in our community with doctors and dentists and nurses and all kind of healthcare professionals. We've done over 60 studies where we have actually engaged the community in the studies and the work. We do that all the time is that when we go out, we find those people that are the ones who should be at the table and we ask them to be at the table. And so the other things about it, is like uh, we have come to the place in our work where we understand what our role is. I had somebody ask me this question, and I remember I was at an event. They said, well, what makes you so successful? And I thought to myself, I said, it's because we like each other.
Yeah.
See, that's a whole
Hmm.
different game. That's a whole
It
different game
is.
when you get professionals together and y'all like each other and you know that you can depend on them. You know that they're going to give out accurate information. You know that you can introduce them to your friends and you know that they're going to try to be culturally competent. And if they screw up, guess what they're going to say? I'm sorry. You know what I
Mm-hmm.
mean? We all screw up, right?
Yeah.
So the whole idea is that we don't have to pretend to be anything. And I always tell people, don't try to be me, just be you. That's what makes us, I think, what makes us successful.
I love that. Great work, Clarence. So, for Men's Health Month
Mhm.
in June, are there any specific events or
Mhm.
initiatives for the community that should be on their radar?
We're going to be doing a lot of different things. There's going to be Juneteenth. There's going to be other kinds of pop-up health fairs that's going to be happening in the community. We actually, at this particular point right now, and I just found out today, we've been working on this for a while, but we have actually created a daddy book for new fathers or for families who are getting ready to have a baby or had a baby. And it's from 0 all the way up until age of 1, where it talks about the development of the child and it gives out tips and clues on how the family could and should or give them options on how they may interact with the child for the development of the child to make the child better or make the child healthier. The book is a rewrite of the book because it started in 2008, but this book talks about the neural nurturing of a child, the brain development of a child, and how the first couple of months is when the brain is being wired. And so there are tips on how do you interface, interact with the families and with the child to make sure that child is healthier. Because if you're not careful, you could provide or you could create additional problems for that child for the rest of their life. We're trying to get a little bit more creative in terms of saying to men that being a provider means a lot more than just money. You know,
Yes.
being a provider means that you also are there, you are available, you understand what enhances the life of the child and of your partner, and that you know when to not get caught up into the emotional drama that families often do. I always talk about, you know, it's so important to know what to do with the in-laws and the outlaws in your family.
Mm.
So for me, it's like when you, I say it like this, when you find somebody stuck on stupid, you leave them there. You don't fool around with that. You know what I'm saying? One of the things that we talk about a lot is don't let everybody kiss on your baby. I know grandma loves the baby and like that, but you know, hold up, grandma, kiss the baby through the mask,
Yeah,
you know, and be okay with that because people say like, well, who do you think you are? I haven't had 15 babies, you know, like,
mm,
yeah, but you ain't, this is my baby. And this is what I
exactly.
want for my baby. And to do that with an amount of care and loving, not anger or bitterness. I heard a story of a baby that got fever blisters on their lips. I
Mm,
don't know who did it. And they probably didn't even know they had blisters on their lips, right? Okay, so the thing
mhm.
about it is give that baby the opportunity to develop immunization. Give that baby a chance
Yes.
to get stronger. And don't take it, grandma, if your son-in-law, or whatever, tell you don't do that. Be okay with that.
Mhm.
So I think those are the kinds of ways in which we interact in the community, going through a variety of different things. You just have to be mindful of that. And I think the same thing with cancer. When people say, oh, you got cancer, they think it's a death wish or
Mm,
they think you're going to die. You know, and
yes.
that's not necessarily so. I mean, that's why you want to get your testing done early enough so that you can address that issue. So you're not in stage 4, stage 5. So that's the kind of things that we try to do in a way that's respectful. I just believe that you have to respect people and you have to allow them the opportunity to either engage or disengage. And that's fine. If you don't want to do it, it's still your choice. But we just want to say, make sure that you understand what the consequences are of these actions. So that's what we do. We're just happy to do it.
I love the work that you're doing. I love the way you all connect with the community and you have fun doing it. It's very obvious
Mhm.
to me that you have fun while doing all the wonderful things that you do to support and help the community.
The thing that I really want to say is I love the idea that we will have a healthy community. I love the idea that we have healthy families and we have healthy individuals. I love that idea. And I really want our community to learn how to collaborate together, to really emphasize and to promote our own personal strengths. One of the things for me is that no one organization can do everything. So
Mhm.
I think it's important that even though you might have a variety of skill sets, learn how to also work with other community members and organizations to provide services because no one organization can do everything and no one organization fits everybody, right? So
That's true.
based on the different styles and things of that nature. So it's really important in our work that we spend time to vet people. That was one of the first things I said to you was that I'm gonna vet
Hmm.
you.
And you
I'm gonna
did,
ask
and you
questions. I'm gonna
are.
probe you. Yep,
Hmm.
yep. It's nothing personal. It's just that when I walk out and I talk to people about you, I want to be sure as much as I
Yes.
possibly can that you're going to do what you say you're going to do. Because I know that for men, they're not going to be going. Women will go two, three, four different doctors, but a man will go to one like, no, that didn't work, and so he'll cut it off. You know what I mean? I'm not saying all men, so I'm just making a general statement. But a lot of guys, if you mess up one time, they ain't coming back. Then they're gonna talk about you. And so my point is to say to them, like, I want to recommend something to you. I usually give them somebody specific to see,
Okay.
somebody that we have a relationship, somebody that we can work with or have worked with, and then allow them the opportunity to do that. Like I said, again, I don't get into that business.
Mhm.
Once you go to the doctor, that's between you and the doctor. But what I do believe, though, is that the business that I am in, that Hue-MAN is in making sure that we are fairly comfortable with our referral and access. And that's how we operate.
Yeah, that referral is like gold. And once that trust is broken, it's a reflection on you and the person you referred. So I understand. I really appreciate that approach because I think vetting and doing a great job at vetting prevents a
Mhm.
lot of problems.
The thing that's so important for me is this. Everything is not going to always be 100%, right?
Mhm.
There's always going to be the opportunity that something goes wrong. But I'm okay with saying I'm sorry. I'm okay with saying that this didn't work. I'm okay with saying those kinds of things. And I always, in terms of even access and referrals and stuff like that, I always give people options. So it's
Mhm.
usually one or two, three things. I tell them why I recommend those things. And I always say that because I always know people. If
Yeah.
you I told them to do something and it don't work, guess who they're gonna blame? They're gonna blame me. So I'm saying,
Mhm.
like, no, let's back up a little bit. Let's back up a little bit. Let me just give you some options and some people that I know. I think it makes it so much easier because it says like, you are a mature person, you're making an informed decision. And you knowing that I will not tell you something just to be telling you something. I'm going to tell you something because I care. And that's what I want to do.
And you do it. You do a great job. As a
Mhm.
fellow doula, I'm very fascinated by your role as a fatherhood doula. And as a cancer
Mhm.
doula, I see how much support is needed to navigate the gaps in the system as well as cancer support. What do you do as
Mhm.
a fatherhood doula? And does your experience supporting fathers overlap with a specific kind of support for men?
First of all, as a fatherhood doula, this is Clarence's style. I work from the waist up. That blood stuff, that ain't me. Okay, so things around breastfeeding, things about working with the mother, those are some of the things that I do. I also talk about the psychological impact of childbirth. We talk about the things that you could expect. Talk about where can you get support at. We talk about questions to ask your doctor when you go in and you're seeing the physician. There's some things that you want to ask. There's some things that you require, some things that you want, you know what I mean? So how do you do that in a way that's very professional, but also very direct? I think the challenge we have sometimes is that when people go and they talk to a doctor or a doctor's talking to a community member, there's an assumption that we cannot communicate. You know what I'm saying?
Mhm.
Is that I'm a clinician, so therefore, I'm going to talk clinician to you. And that doesn't work. That doesn't work with somebody that's really emotional, engaged, and like, want to make sure that we're communicating clearly, right? And
Mm.
then sometimes from the community perspective, they want to share their emotional feelings. And it doesn't help when the doctor feels like, well, you can take more pain than other folks.
Yeah.
That's not okay. You know what I mean? So you're in this thing where you didn't respond in a way that I felt most appropriate. So, what can I say to you to help us to get to a level where we understand one another, right?
Mhm.
Doctor will come in and say, this is the way that it's done, but this is my body. You can't tell me how I feel, right? I can tell you
Mhm.
how I feel, and hopefully you can respect me enough to allow that to be a part of our conversation.
That's wonderful. I appreciate that so much, Clarence, because a lot of times when a woman is having a baby, it can feel like everything's on her to learn about all the changes that are coming, to prepare for everything. And it's great that you are helping fathers to be more hands-on, helping them to ask the right questions, get the support that they need to show up and support their partner throughout childbirth. It's so needed.
Well, I think one of the things that we talk about a lot is the fact that the guy contributes a lot more than just a sperm.
Yeah.
And the guy wants to be more involved than just sitting in the background and saying, yeah, that's my baby kind of thing. He wants to hold the baby. He wants to be engaged with the child. He wants to make sure that his partner is comfortable, that things are going well. He wants to make sure that she can rest, that the baby will be healthy, all those kinds of things. And so all of those things require a certain level of engagement. And for me, when the baby's brain is being wired, you don't want no drama. You don't want people running up in the hospital room and saying, "Oh, that's my grandchild." Da, 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 da. Yeah, right. Okay. Look at the baby through the glass. Okay, whatever. I mean, what I'm saying? Just like, don't come in here bogarting me, and then don't dismiss me.
Yeah.
And don't dismiss me. Or, well, you man don't know nothing. Well, you don't know that. You know what I mean? And so for me, it is like, how do you maintain a level of caring and sharing without being in a place where you have to argue? You know what I mean? And having a baby, man, that's an emotional time. We talk about this. We talk about the man needs to talk to his partner about what they expect. What are the rules so that they are on the same page and in agreement? You trying to set rules when the baby is coming out, it ain't going to work. You need to set those rules and talk about those things before the baby comes out and before your friends and relatives come by, just so that you're on the same page. And so can't nobody get it between you, and your relationship. It sounds like I'm being kind of flippant, but I'm not. I just know that we have issues like infant mortality. We have issues like underweight babies. We have all kinds of issues. And the more that we can help families to be prepared for that, more that we can help fathers to understand, again, that protective role. It's important. I always talk about the fact that the hormones be raging when a woman is pregnant and things like that. But he's also impacted by that. But it's like she might just want eat ice cream all the time, and so you need to be able to get us a meatloaf or something, don't always get snacks and stuff like that. She might want McDonald's. No, give her an orange, but be able to do it in a way that's honoring her and just saying, baby, you know what? You got to make sure that the baby is healthy, so I know you want this, but can you work with a brother for a little bit? You know what I mean? You might use different language or something, whatever. I don't know, but you just saying, look, I realize that this is what you're desiring. And sometimes it's okay, but you just can't keep eating ice cream all the time. You say that lovingly. You say that lovingly.
Yes. What I'm hearing you say, Clarence, is be proactive. Don't wait to make all these very important decisions once the baby arrives, because that cuts down on a lot of tension, a lot of stress, and have your boundaries established. You have informed your family how you expect things to go and how you want them to interact with you and your child. So I think that's really important, because that cuts down on a lot of stress after she's had the baby. She's already stressed out. And like you said, hormones are raging and everything's different and new.
I think one of the other things too, I know we're talking about cancer. I think one of the things so important is that when someone in your family has cancer, it's really important to learn as much as you can about it, and then to figure out how you might be supportive of them as they're going through the process. You know what I mean? Again, people think like it's a death sentence, but it doesn't necessarily have to be like that. But I think that because there is so much misunderstanding about it, we need to learn more. But I also think this, people need to be involved in cancer studies.
Yes.
There are studies that are out there that people need to know so that they can be an advocate and people can learn from them and they can help to educate our community better. Because one of the things that happens so many times that if we're not involved in a study, then sometimes a lot of lessons are missed.
Yes.
So it's important that you ask the questions, and if there is a study or something that you would like to be involved in, that you would volunteer or you would take the time to be engaged.
Thank you for sharing that, Clarence. That is a really great point, because they are doing all these studies in research on other races. How do we know how that's going to work for us if we're not part of those studies? And, By participating in studies, we have the opportunity to help create something for the next generation that will save their lives. So I think education around studies and research, clinical trials, I think there's so much education that needs to happen, particularly in our communities, the Black communities around that, and how it can actually benefit them.
I always talk about the legacy. What legacy do you want to leave? Somebody made the example of when you go out to the cemetery, you see the day the person was born, the day they died. And then there's a dash in between. You don't know nothing about that dash in most cases. And my point is, what do you want your dash to look like? What kind of legacy do you want to leave for your family, for your children? Unfortunately, a lot of people feel like, well, I've never done anything, but they don't know how much by participating sometimes in some of these things, how much they can help. You know what I'm saying? So that's one of the things for me. I think it's important.
Thank you for raising that up in the conversation because a lot of people think about that when it's too late, when they're near the end. And there's so many things you can do. It doesn't have to be anything big and extravagant to make a difference. Leave a legacy, and legacy is different for everyone. And I want to encourage the valued listeners out there, if you haven't already, think about what Clarence said. What do you want your dash to look like?
I think that it is so important, especially in terms of talking about cancer, that we don't make assumptions, that we go ahead and get testing because some of this stuff is genetics. And if your family has a history of these kinds of diseases or illnesses, go get tested. Take the time to do that. And you do that for yourself, but also for your family. Because when you get sick, it takes a real big toll on your life and on your family. And so you want to, as much as possible, be proactive in terms of taking care of your health. I believe that a lot of people now are much more interested in doing that, but I just want to encourage people to make that a priority.
Clarence, just thinking about your experience with cancer, the people that you've supported, when you hear the phrase navigating cancer together, what does that mean to you?
I think that's talking about a support system. When you find out that you have cancer, you need to find people that will work with you, will support you, will ally with you in terms of moving through this particular trial. I think sometimes when people find out they have a disease like that, they want to withdraw. They want to be a burden on other people, right? But the fact is, by not letting people know that you need their support, you need their help, you wind up doing more damage than you need to. When I found out my PSAs were rising, I wanted people to know, not everybody, I just wanted some people to know, like, hey, you know what? I'm watching this, and I would talk sometimes to my friends. I'd say, like, my PSA is rising. And they would talk about their experiences. They would talk about somebody that they knew. So there was a support system base. And when I went to get my operation, I had friends like, hey, how did it go? Da, da, da. You know what I mean? I had that support system. And I think that that's important. Do not try to navigate this by yourself because it impacts more than just you. And don't be selfish. That's the other part too. Don't be selfish and scared. The reality is that you probably didn't do anything to cause that. It's life. With life, you want to find people that are in your corner.
Great advice. And speaking about life, as we wrap up, I want to focus on life perspective. As facing cancer reminds us that everything's temporary. What is something that you're willing to let go of to make room for an amazing, once in a lifetime experience?
That's an interesting question. I think that it's a little bit interesting. Your question that you framed is a little bit more interesting than what I thought you were going to say. But, you talk about temporary life. I think that part of the thing for me is that I'm a person of faith. That is important. So I understand that life is short, that life is temporary, right? And I think that you have to prepare for where you're going to go whenever you go, if you believe that, okay? But I do think that one of the things that I'm willing to give up is the fact that I can control anything or everything. I can't control everything. And so I'm willing to give that up in order to seek the help that I need in order to be able to be healthier. So that's what I would give up. I'm like, okay, I'm not going to operate on myself. You know what I'm saying? I'm not going to take my blood, because I don't like blood. I mean, I do love blood, but you know what I'm saying? But what I'm going to do is I'm going to find those people that can help to assist me as I go through this journey and to get people in my life that will be proactive and not reactive, and people that will be supportive. Those are the kinds of things that I looked for on this cancer journey. And even now, my friends will call me up and say, hey, how's it going? And that makes me feel good because then I got to go back and get another blood draw. You know what I mean? So I know that there are people that care about me. They're as interested in the results as I am. So like, yeah, I'm doing good. So we can support each other, but it also allows us the opportunity to be able to develop an attitude about why we should talk about it. And so those are the kinds of things that I believe.
I love that. As we wrap up, Clarence, there is someone out there who just received a cancer diagnosis of some form. And they are exactly where you were at some point and where I was at some point. Do you have any additional words of encouragement that you would offer to them in this moment?
I do. And here's what I want to tell them. Call Talea. that
Thank you for that
That's
plug.
that's what I would do. And I've been, yeah. I've been telling all my friends about you. Like,
Oh,
yeah, I know
thank
that lady.
you.
Yeah, like what? You know what I mean? So yeah, I'm not being flippant or disrespectful or any other kind of thing like that. I'm just serious. When you find someone who has self-identified, that's the lane that they want to be in. And when they can clearly articulate, this is what I'm doing and why I'm doing it. We talk about why did you do this and those kind of things. When you're really clear about your mission and your purpose and your plan, yeah, I'm gonna let you do that because you will be able to uncover in me the areas where I've been hiding or the
Yes,
areas
sir.
where I'm afraid to talk about them, and you'll be able to provide me with resources. And man, please, again, it gets back to that point that we talked about before. It's where you have the credibility, where you have the credibility, and you can be referred to by people who trust you and trust your judgment. And that makes a whole line of difference for the people that we work with. Go to
Thank you so
Leia.
much. Thank you so much, Clarence. That means a lot. And I so appreciate you. I have the utmost respect for you and all the amazing work that you're doing in the community and beyond. Anything, Clarence, before we wrap up that you haven't had an opportunity to share that you would like to share?
I truly, sincerely want to thank you for the opportunity for you allowing me to be on your show. I thank you for the fact that you had a vision to do this show. I do believe that the work that you have chosen to do is so very important and it's going to grow. And I hope that if there are others out there that want to embark on this journey, that they reach out to you and allow you to do it. I know that you are in that phase right about now where you can explore a lot of different kinds of things. And I'm hoping that during this phase that others will reach out to you and you're able to duplicate yourself 2, 3, 4, 5 times, And
Mm.
so if somebody's listening and they want to be more involved in terms of helping our community be healthier, I hope they would talk to you, especially around cancer.
Thank you so much, Clarence. And thank you for your time. It's always a pleasure to talk with you. I just appreciate you so much. I can't say that enough. And thank you for all that you do to improve the health of our community.
Thank you again.
Before we end, I would like to give a shout out to the Navigating Cancer Together community and valued listeners. Thank you so much for joining us today. That is it for this Wednesday. And until next time, let's keep navigating cancer together. Take care.